Continuing distally, I'm going to apply firm pressure over the proximal sesamoid bones and then moving down into the pastern region, applying pressure over the superficial digital flexor tendon, the deep digital flexor tendon, and right down distally over the deep digital flexor tendon between the heel bulbs. Abnormal reaction generally reflects injury. I'm going to hold up the limb via the metacarpal region and look at the balance of the hoof capsule. And I'm also going to palpate the heel bulbs to determine whether or not there's any instability between the heel bulbs, as indicated in the image on the right, reflecting the condition sheared heels. I'm going to look at the hoof capsule from all angles, both weight bearing and with the limb off the ground. In the image on the far left, we can see that the coronary band is displaced proximally on the medial aspect to the right. We know the biomechanical consequences of such a conformation. The lengthened side of the foot lands first, the ground reaction force shifts towards the elevated wall. In the central image, we can see that there is more pastern and foot to the right of the line which perpendicularly bisects the metacarpal region. This is not normal conformation. And in the image on the far right, we can see that this horse has got toe-in conformation, and in association with that, the medial aspect of the coronary bands is higher than laterally. It is important to recognize poor trimming and shoeing and what can be achieved by improvements. In the top image, we see a very distorted hoof capsule. The dorsal aspect of the hoof capsule is not straight, and the angle of the dorsal aspect of the hoof capsule is very different to that of the heels. Below, we can see the same foot after improved trimming and shoeing and see a very substantial difference. Observe whether or not the front feet are asymmetrical, as seen in the top left image and in the bottom images comparing the right and left front feet. The right front foot is much more upright and taller and narrower than the left front foot. There is substantial evidence that horses with asymmetrical front feet leave the sports horse community earlier than those with symmetrical front feet as young horses. Be aware also of the influence of shoes that are too small. In the top right image, we see the size of the shoe that was removed from the left front foot and the shoe that replaced it. Take note of distortions of the hoof capsule. In the image on the left, we can see a subtle bulge on the dorsal aspect of the hoof capsule. This was associated with this large space-occupying lesion in the dorsal hoof wall, highlighted by the yellow arrows. In the image on the right, we can also see a rather curved contour of the dorsal aspect of the hoof capsule.